Hi, let's see an NCLEX RN video based on care of patients with burns. A patient is admitted to the emergency room after sustaining an electrical burn with contact points to his right hand and left foot. The patient is being resuscitated with ringer lactate solution using the consensus formula. A urinary catheter was placed and the nurse observes myoglobin in the urine along with a decrease in urine output. What is the most appropriate nursing action? Give the patient a normal saline fluid bolus, notify the physician and anticipate increasing the IV fluid rate, administer a diuretic, continue monitoring the patient. So here the patient is having myoglobin in the urine and a decrease in urine output. So when myoglobin is present in urine, it will obstruct the renal tubules gradually. So the intravenous fluid rate need to be increased and physician to be notified. Patient is admitted to the emergency room after sustaining a flash burn to his face. He presents his facial burns and sign nasal hair but is reporting no difficulty breathing. The nurse places the patient on 100% oxygen by a face mask. Upon reassessment, the nurse notes that his voice has changed and the patient is reporting difficulty swallowing. What is the most appropriate nursing action? Notify the physician and anticipate endotracheal intubation, obtain a chest radiograph, administer a bronchodilator, lower the rate of the patient's IV fluid. So patients who have sustained an inhalation injury may have difficulty swallowing and they may report hoarseness or change in voice. So here we need to notify the physician and anticipate an endotracheal intubation. Patient weighing 100 kg sustains a burn at 14 hours covering approximately 50% total body surface area. The patient is a young healthy male with no medical history. Using the Parkland formula, how much fluid should be infused by 18 hours? 20,000 ml lactated ringers, 10,000 ml lactated ringers, 5,000 ml lactated ringers, 2,000 ml lactated ringers. So the Parkland formula, you know that it is 4 ml into 100 kg into 50% total body surface area, which is equal to 20,000 ml. Half of this ml, that is 10,000 ml, needs to be given in the first 8 hours. Therefore, half of that 10,000, that is 5,000 ml, needs to be given within the first 4 hours of resuscitation. So the answer is 5,000 ml ringer lactate. The nurse anticipates which burn patient will require higher fluid volumes during resuscitation. A 45-year-old female who sustained an inhalation injury, a 65-year-old male with an extensive alcohol history, a 22-year-old male who sustained an electrical burn, a 32-year-old healthy female with a thermal burn. All patients selected have comorbidities that predispose them to typically require higher volumes of fluid during the resuscitation period. So here fluid resuscitation is required for 45-year-old female who sustained inhalation injury, a 65-year-old male with an extensive alcohol history, a 22-year-old male who sustained an electrical burn, a 25-year-old male presents to the emergency room with a chemical burn to the hand. What is the nurse's first intervention? Delay treatment until the chemical is able to be identified. Elevate the extremity to promote circulation. Protect yourself, remove the patient's clothing and begin irrigation with copious amount of water. Contact the poison control center to determine the most appropriate neutralizing agent. Personal safety is always the first priority, followed by irrigation with water. So here protect yourself, remove the patient's clothing and begin irrigation with copious amount of water. The nurse recognizes which etiology as consistent with the thermal burn. Direct current, scalding, exposure to organic compounds, Ionizing radiation. Thermal burns can be the result of flash, scald or contact with hot objects or flames. So here scalding. Direct current is one directional constant flow of electricity. Radiation burns are associated with industrial use of ionizing radiation, nuclear accidents and therapeutic radiation treatment. The nurse correlates which clinical manifestation to superficial partial thickness burns. A scar, dry leathery appearance, blisters, waxy appearance. Superficial partial thickness burns often have a wet, weeping blisters and are pink in color. Deep partial thickness burns appear waxy and do not have the characteristic weeping blisters that are seen in superficial partial thickness burns injuries. Full thickness burns generally have no blister formation and are always very dry and feel like leather to touch. So here the superficial partial thickness burns have blisters. The nurse correlates which zone of burn injury as the most susceptible to sustained injury because of insufficient fluid resuscitation. Zone of stasis, zone of conversion, zone of hyperemia, zone of coagulation. The zone of stasis immediately surrounds the zone of coagulation and is characterized by damaged cells and impaired circulation. It is this area of the burn that is most at risk for conversion if the patient does not receive adequate resuscitation. The zone of coagulation is the area that has the most contact with the heat source and is the location of the most severe damage. The outermost area is termed as the zone of hyperemia and is generally an area of increased blood flow in an effort to bring key nutrients for tissue recovery. So, the most susceptible to sustained injury because of insufficient fluid resuscitation is zone of stasis. The nurse recognizes that burns to which body areas meet the criteria for referral to a burn center because of the increased risk of functional changes. Chest, perineum, elbows, face, hands. According to the American Burn Association, referral criteria to a burn center involves injuries to specific areas of the body including the face, hands, feet, genitalia, perineum and burns over the major joints. So perineum, elbows, face and hands. Burns in these locations involve functional areas of the body and may require specialized and highly skilled intervention in order to restore optimal function. The nurse correlates which clinical manifestation to the possibility of an inhalation injury. Facial burns, sign nasal hairs, soot in the sputum, hoarseness, scar. Patients that have sustained an inhalation injury may have facial burns, sign nasal hairs, soot in the sputum and hoarseness caused by edema and irritation. So facial burns, sign nasal hairs, soot in the sputum and hoarseness. An abnormal EKG is not indicative of an inhalation injury as well as a scar. Using the Advanced Burn Life Support ABLS resuscitation guidelines, the nurse determines that a patient requires a total of 12 liters of fluid in the first 24 hours post-injury. How much of this total volume needs to be given within the first 8 hours? 4000 ml ringer lactate, 6000 ml ringer lactate, 8000 ml ringer lactate, 10,000 ml ringer lactate. According to the Advanced Burn Life Support Resuscitation Guidelines, half of the total calculated volume is given within the first 8 hours. So that is 12,000 liters, half is 6,000 ml lactated ringer. When hemodynamic status is monitored in a patient with a burn injury, what amount of urine output indicates adequate fluid resuscitation? 0.5 ml per kg per hour, 1 ml per kg per hour, 2 ml per kg per hour, 3 ml per kg per hour. Adequate urine output of 0.5 ml per kg per hour is crucial in a burn patient to maintain tissue perfusion and organ function. The nurse recognizes which diagnostic test is more sensitive in a patient with a suspected electrical burn injury: arterial blood gas, CKMB levels, echocardiogram, serum carboxyhemoglobin. For electrical injuries, it is important to obtain a baseline electrocardiogram, troponin and CKMB levels. A serum carboxyhemoglobin level is obtained on all patients with suspected inhalation injuries. Arterial blood gas are important to monitor overall respiratory status but are not selective to electrical injuries. Likewise, an echocardiogram is indicated for assessment of cardiac function that would not be immediate in patient after a burn injury. So here CKMB levels need to be obtained as a baseline for electrical injury. Which intervention is a priority for the patient during the emergent phase of burn management? Application of silver sulfadiazine cream, use of cream, clean dry sheets and warm blankets, initiation of wet normal saline dressings, maintaining the injured area open to air. The burn wound is not the first priority during the emergent resuscitative phase, as more life-threatening issues often take precedence. The burn wound is covered with clean dry blanket to prevent hypothermia, but the initiation of wound care may be delayed for several hours until the patient is stabilized. So here the priority in the emergent phase of burn management is use of clean dry sheets and warm blankets to prevent hypothermia. The nurse anticipates supplementary feeding via a nasogastric tube in a patient for which reasons? Hypermetabolic state, multiple open wounds, increased heat loss, increased caloric needs, burn greater than 20% total body surface area. Supplemental nutrition should be considered for any burn patient who has sustained a burn greater than 20% of body surface area. And in addition to that, burn patients have open wounds are in a hypermetabolic state resulting in increased caloric needs. So they have a hypermetabolic states and they have multiple open wounds. Therefore, there is an increased caloric need. For patients greater than 20% of total body surface area. So Joe is a 40-year-old male weighing approximately 220 pounds who presents to the hospital's emergency department with burn to his face, anterior trunk and bilateral upper extremities. He has sign nasal hairs and curvaceous sputum but is reporting no difficulty swallowing or breathing. He sustained the burn while throwing gasoline on a brush fire. He has no past medical history and is currently taking no medications. The patient has been placed on 100% oxygen and has 2 large bore peripheral IV catheters. The burns are pale and dry and the patient is not complaining of any pain except for around the edges of the wounds. It has been determined that Joe's wounds are full thickness. Current wound management include silver sulfadiazine cream twice a day. The surgeon has determined that the patient requires surgery. Medical and nursing priorities continue to focus on pain management and infection prevention. Joe's surgery is successful and he is prepared for discharge to home. During discharge teaching, the nurse discussed the importance of proper nutrition to promote wound healing as well as monitoring for signs of infection. The nurse ensures that Joe has appropriate referrals for psychological and rehabilitative. On the basis of the initial burn wound description, what depth of injury has this patient sustained? Superficial, superficial partial thickness, deep partial thickness, full thickness. So here the burns are pale and dry, indicating that the damage involves the epidermis, dermis and parts of the subcutaneous tissue. So the patient has a full thickness burns. Using the rule of 9, what is the approximate size of Mr. Joe's burn injury? 80% total body surface area, 65% TBSA, 40% TBSA, 24% TBSA. Using the rule of 9, Mr. Joe has 40% of total body surface area because the trunk is 18%, the extremities are 18% and the face is approximately 4%. On further assessment, Mr. Joe established TBSA is determined to be 45% and his weight is 20 to 220 pounds. Using the resuscitation formula, the nurse calculates what volume to be administered during the first 24 hours. 9,000 ml ringer lactate, 14,000 ml ringer lactate, 18,000 ml ringer lactate, 21,000 ml ringer lactate. So here resuscitation formula for the patient would be 2 ml into 100 kg into 45, that is total body surface area. So that is 9,000 ml to be given in the first 24 hours. The nurse anticipates that the donor site of Mr. Joe will be from which area? Upper extremity, thigh, scalp and chest. The surgeon is able to typically recover one continuous sheet of donor skin. In addition, taking the donor site from the thigh helps to eliminate obvious scarring. What are the nursing priorities for Mr. Joe during the rehabilitative phase? Prevention of contractures, sustaining oxygenation, compliance with physical and occupational therapy regimes, psychological readiness for integration into society, fluid resuscitation. Priorities during the rehabilitation phase of the burn injury focus on maximizing the function and minimizing the complications such as contractures and infection. Issues related to oxygenation and fluid resuscitation are priorities in the emergent phase of burn injury. So here during the rehabilitative phase, prevention of contractures, compliance with physical and occupational therapy regimes, and psychological readiness for integration into society are required. Hope you understood this video on burns. Thank you so much. Keep to watching.